where the health department is continuing with its vaccination campaign against measles in the Ngaka Modiri Molema District municipality. The project aims to encourage parents to vaccinate children up to the age of 15. This comes after more than 160 cases were recorded in that province. Provincial Health MEC Madoda Sambata has described the situation as alarming. Well, let's get an update now, and we'll speak to Refiloe Seboko, joining us from the Ngaka Modiri Molema District municipality there. Refiloe, good morning to you. The situation in that province is worrying as far as these measles cases are concerned. Over 100 of them have been reported. How are authorities dealing with it?
Good morning, Kholi, and good morning to our viewers. It's a bit alarming indeed, like you rightfully said, that MEC of the Health in the Northwest Province, Madoda Sambata, they're here in Ventersdorp. This is where they are continuing with their campaign and also encouraging and urging parents to continue and take their children for vaccination. What we are seeing, the young ones are here in a school in Ventersdorp. This is where the vaccination drive continues, and you indicated we're going to just welcome a spokesperson of the Northwest in the of the Health in the Northwest Province, Ngaka. Thank you so much and welcome to Newzroom Afrika. The last time we checked, there were about 168 cases of measles in the province. Give us the latest.
Well, the latest is that we now have a total of 171, which is a peak in a space of a week. The thing is, we are doing all that we can to go after these cases. We are not sitting and hoping that the children will be brought to their facilities. We are going out. It's an outreach campaign. As you can see today, we are here in a farming community because we think that even these farming communities need to be reached so that all the eligible children can be immunized.
Let's talk about the program that you're talking about today in terms of the kids that are here, their age group, continuing to urge parents to make sure that they get vaccinated.
Well, the target, of course, is 6 months to 15 years. And that is why we target schools like this one, which is a intermediate school. Most of the children here, you can see all of them under 15 years old. They are the people that we are looking for. And we are glad that the farmers, we must thank the farmers because this is a farming community. All these children are from the nearby farms. They attend in this school in a farm. And the farmers have opened up their arms. This is an integrated service delivery approach. We have the municipality here. We have the Department of Education. Early on, at the beginning of this campaign, we met with the Department of Education. And we must thank, actually, the COVID, because COVID has taught us to work together, and it did not really take long before we could come together and come up with a plan, which we are implementing now through the Integrated School Health Program.
How do you see this program working in terms of the vaccination drives that are happening in the province? Would you say that you're able to, as much as you are counting infections, are you able to count and tell the numbers of those that, have recovered, if one can put it like that?
Very well, and we are grateful of the fact that we have 171 cases, but we can see that now over 160 have recovered. We say over 160 because the latest is 10. Just over 160, those are the cases that have been and they have been receiving treatment. And what we can say is that this must continue to cover all the children. And the campaign has gone very fast. If you see that we are now over 720 coverage in terms of the learners that we have immunized this far.
And like let's to ask parents in that they must take children for immunization, be it at local clinics. But when you are taking your drive-in campaign to the schools, what is the communication that you are having with parents and also with the kids in preparing them, for those vaccinations? I was just having a chat. I think she said she's 10 years and she's fully aware of what's about to happen. She said her mother said today at school there's going to be this, and you must make sure that you get that injection. What is your communication with parents and also with the kids in preparing them for these vaccinations?
Well, we are grateful because we have the governance structures, your clinic committees, hospital boards, and when we come together with the Department of Education, we also have school governing bodies. These structures have been key in ensuring that the message gets across very fast. So you can see even the councillors are participating here to make sure that the communities get the messages very fast, and also tribal authorities. But very important, and we try to shy away from giving messages that are threatening to people, putting fear. But this is a deadly disease. It's serious. When you look at the situation in Zimbabwe, where over 700 children have died out of this disease, and you see a situation where we can link the outbreak in the province from those who travel to Zimbabwe. And then we are saying, do not sit down and relax and think that this is just any other illness, it will pass away. No, the more it spreads, the more the riskier and the more chances that we are going to lose lives in the province. And
what continues to be of concern to you as the department, considering, the number that is growing? You said like in a space of a week it's worrying. What continues to be that thing that is alarming for you as the department?
Well, what will concern us at this stage is that some of the areas are difficult to reach, like farm. That is why we targeted a farming community. It means we need to go to other farms. We can't just say we are fine with this one. We need to have a campaign that goes to all these farms to make sure that these children have access. Because remember, some of them receive health services through mobile clinics. And when you talk about the immunization, the vaccination, it's urgent. You can't wait for a mobile clinic. So we need to make sure that all the response teams are on the ground, going into all these farms, going into rural communities that might be having challenges in terms of access.
Thank you so much for your time. He is the spokesperson of health in the Northwest Province. These vaccination programs are ongoing. The case so far, he just confirmed that 171 in the province cases of measles, but they will continue to intensify their vaccination drives.
Refiloe Seboko, thank you very much for that update. Live for us in the Northwest Province there.